That's good. Hi, Seth.
How's it going?
Good. How are you? Welcome.
Good, good. My last meeting wrapped up at least on time. So
Good. Perfect. Yep.
Yep, everything seems to be working. PowerPoint uninstalled itself an hour ago, but I reinstalled it, so we're good.
Perfect. I have your slides if needed. Okay.
Awesome, awesome. I appreciate that.
Yeah.
Quickly refill my mug of tea. Be right back.
We welcome everybody joining. We're so happy you're here today. We are really excited about this webinar today. We are going to get started right at 2 o'clock. So in just a few minutes, we'll get started.
All right, now I'm all set.
Welcome to everybody joining us. We are so thrilled that you all are here today. We will get started in just a couple of minutes because there is a lot of data and a lot of information to be shared today. If you'd like to go ahead, as many already have, and introduce yourself in the chat, that will be wonderful. So we can kind of get a sense of who's on today. Okay, good afternoon, everybody. It's exactly 2 o'clock and we want to go ahead and get started so we can maximize the time for our wonderful panelists we have here today. We welcome you all to this human trafficking webinar that we relink.org are absolutely thrilled to host. We have had over 350 people register for this webinar from all over the state of Ohio. We've been overwhelmed by the response, and we know that this is such a topic that breaks all of our hearts, and everyone that we've talked to in preparing for this webinar just has this intense desire to see this evil rid from our society. So I thank you all for your interest and your passion in this topic. I want to go over a couple of housekeeping items. Everyone is muted because we have so many people participating. Everybody joining in is muted, but that doesn't mean we don't want to hear from you. So please introduce yourself in the chat so other people can see who's on. We also want everyone to ask questions. Please utilize the Q&A to post your questions, and we will get to as many as we can at the end of the webinar. And if we don't get through with everybody's, we will follow up on all those questions via email. We are going to do our best to get done after an hour, but the team will stay on after 3 o'clock for questions if that's needed. The first thing I want to do real quick is introduce our staff to you today. We have on today Bill Pica. He recently joined us and we are thrilled to have him on the team. He is doing all of our data for us. So a lot of the questions we get about relink.org is how do you maintain your data? There are lots of ways we do it, but Bill is definitely one of them. And we're really thrilled to have him on the team. And we also have with us Sarah Capri. Sarah, I think part of your screen is showing over the slides. I'm not seeing a perfect view of your screen. I don't know if Christy or Seth, you have the same view that I do, but I'm only seeing.
I'm seeing a perfect view.
Okay, great. So if it's just me, wonderful.
Hopefully it's just you. I'm not sure how to
Hopefully
fix
it's just me. It's usually me, so that's great. All right. Perfect. I just wanted to make sure. But Sarah has done an amazing job preparing for this webinar, and I'm really thankful for her to be on our team. She is our statewide communications coordinator, and she has done a great job. Since she's joined our team, our utilization on relink.org has nearly doubled, and we're really grateful to have her here, and I'm really thankful for all she's done to prepare for this webinar. And we have 2 additional wonderful speakers with us today. I'm really excited. I was telling them before this webinar, I can't wait to hear everything you guys are presenting. So I'm really happy that you guys are here. We have Christy Scott Bartman here with us with Eyes Up Appalachia. And she has been involved in human trafficking and stopping human trafficking for over 10 years now. She's been advocating, she's been educating, dispelling myths, and doing everything she can to share what she's learned and get everybody involved. So we're really thankful that she's here with us today. And we also have Mr. Seth Boughton with us from the Ohio Network of Children's Advocacy Centers. And I'm just getting to know Seth, but from what I've heard, he is like a data genius, is words I've heard people describe him as. And he's an expert in anti-trafficking research. And he also has a background as a crisis worker, which when I read those 2 things, I'm like, oh my goodness, he's got the perfect background for what we're talking about today. And from what I understand, some of the data that they're going to share here today, this is one of the first times that it's been shared publicly in a group this large. So we are really excited to have you here. And I want to first turn it over to Ms. Sarah Capri, who's going to tell us a little bit about relink.org, but specifically the resources related to human trafficking that we have on the site. So it's over to you, Sarah.
Thank you so much, Barbara. Thank you for all the introductions. I appreciate it. So I am here to discuss relink.org, how it can be utilized in situations dealing with human trafficking, just as well as being utilized in general, if some people haven't heard of it before. So we started as an addiction recovery service. Our founder, Ray Dalton, he has a son who struggles with addiction, and he started this as like taking everyone's black books of addiction resources, pulling everything together in one place to share with other families going through the same thing. It snowballed as things do and turned into pretty much the Ohio-wide black book of all kinds of resources. So to dive in a little bit deeper, just within this last year, these are our numbers. And so it's been even more than this in the past many years that they've been working on the project of relink.org. But in just the last year, 18,000 Ohioans logged on and used relink.org for various resources. There's over 120,000 different services on relink.org that are offered in Ohio, which has grown and grown every single year. There's been 201,000 resource linkages. So essentially people logging on and finding different resources that they may need. These resources stem from, like I said, started with addiction, and then you can see across the way here, it just moved into so much more. So under the category of addiction, we have resources for treatment and housing and peer support. And then it moved into, there's also people struggling with addiction who have experienced human trafficking. So crisis, employment, support services, prevention, all of that. Under basic needs, we offer resources for food, shelters, clothing, furniture, which is a more popular search than you would think. And then reentry has actually become one of our largest search categories. So housing, employment, education for individuals who have previously been incarcerated, who are getting back on their feet and getting back into society. These are current human trafficking resources on our site. We thankfully have Bill, who is aggregating data from all over, and we find new resources every day. And we are connected with people like Seth and Christy, who are so within that world that they're able to provide us with more information and things like that. But this is what we have on our site currently. We have over 300 providers that offer human trafficking resources on relink.org. Franklin and Hamilton County lead that with over 50 providers in each of their cities. And it's one of the largest search increases in recent months on the site. So human trafficking searches are exponential right now. And then on top of that, one of our other larger searches recently has been rape crisis centers. And so that's related. And so that we find that very alarming and very interesting. And I think that's why we've probably gotten so many people on this call today, is because it's on the rise in terms of searches. So using relink.org, I'm going to stop my share and pull up a new one. This is relink.org. This is the front end. This is our WordPress page. If you click find resources now, and then you get to our needs page here, this will come up with all of the different resources that I explained before. So you can search by either zip code or county, or if you totally know what you're looking for, you can search by provider name as well. So it just depends on exactly what radius you're looking in. For the example in the demonstration today, I'm going to go to Athens County. And so you have to click search first here. And then I'll click on human trafficking. And then I was going to demonstrate how to find both SAOP, so Survivor Advocacy Outreach Program, and Christie's Eyes of Appalachia organization as well. And so I am going to go to Prevention and Awareness Programming, and you'll find Survivor Advocacy Outreach Program in Athens County. Once you click on this, it'll offer you the phone number, a hotline, their address, how to contact them, and then kind of a little more info on what they exactly do. And this revolves around specifically human trafficking. Again, you can search for any different organizations or needs that you may have. So to begin another search, you can just go back to the beginning, click on human trafficking, and I'll go to support services. And I'll make sure I'm in Athens still. And then groups and coalitions, you'll also find Eyes Up. And you'll be able to find exactly what you need in the area you are looking for. Again, phone number, email, contact is Christy, of course. And so you're able to find what you need from there. Let's go back to my old share. So that is how to use relink.org. And if anyone has any questions following this webinar, or any concerns or anything like that, please reach out to us at info@relink.org. Or you can visit the website and kind of fiddle around with it yourself and see what works. And otherwise, this is also my office number here at 216-762-0591. So you're able to reach out to us with any questions that you might have regarding the site. So that is relink.org. If you have any questions, also please put them in the chat. We're happy to talk to you during this and afterwards as well. And I'm going to hand it over to Christy. You're muted, Christy.
There we go. Hey, everybody.
go.
Thank you so much for coming. I really appreciate you being here. Thank you to Sarah and Barbara and Relink for having us on. And I got to say, Relink is a great resource. So for those of you that haven't had a chance to explore it, please take some time. And for those of you that are in the different counties, explore your counties. And if you have ideas on resources, please funnel them up to Sarah, because we're trying to build that out to make it a really viable product. So please
Absolutely.
jump in there. I am going to share my screen right now, and we will talk just a bit. There we go. Okay, so when we think resources and when we think numbers of individuals that are trafficked within Ohio, most of us just kind of go, we just don't have good prevalence numbers. We just don't have the good data to support our decisions, whether they be service decisions, whether they be policy decisions, any decisions. We just need that data. And so I was fortunate enough to be asked by the individuals that are with the Public Affairs 5620 Rapid Innovation for Public Impact class to be a problem sponsor. Now, this is a class over at Ohio State that works on wicked problems. They initially started out with military defense, but they've opened up into the social problems. And so what happens there is a problem sponsor comes in, they detail a problem that they'd like to be solved, and then Ohio State pulls in through this class a diverse student group to help address that problem. And they bring everybody in from different disciplines. And so these are the students, Sarah, Haley, Maddie, Edna, and Eli, that were on my project for Eyes Up Appalachia. They come out of engineering, they come out of policy, they come from different dimensions within the university itself, so that we can look at the problem from different ways. And the way it's set up is they have a problem sponsor, me, and then we have a mentor. And so for our situation here, we brought in David Corliss. So David is an astrophysicist by training. He is a data scientist. He's a statistician by work. And he's the founder or director of Peacework, which, attorneys do pro bono work. Well, statisticians and data specialists do their pro bono through Peacework for him. And so it was a wonderful match. And so I brought the qualitative side, he brought the quantitative side. And so the problem that we posed, that Eyes Up posed to the students, was that for the prevalence data within Ohio, we have siloed data, meaning that those organizations and individuals that do report it up their chains, but it's not shared much of the time. There are mandatory reporters, law enforcement reports, a number of organizations report, but it's not shared. Sometimes there's bad data. Many times, you'll see that even individuals within these agencies don't exactly agree on the definition, say with human trafficking, what would qualify. And definitely when you get into the risk factors and the vulnerabilities and what pushes something over into a trafficking situation, that's also, it's very hard for us to get all the data talking together on the same sheet of paper. And then on the other side, there's insufficient data. So we do have some of the folks that do report, and they report up through their channels, but there's a whole lot of other folks out there that work with this population that the data doesn't come up, the data is not getting up. And even if they keep their own data, it's not being aggregated at any point. And so those are some of the situations that we're dealing with data in Ohio. We've got a lot of agencies that are looking to try to change that. The Attorney General's Human Trafficking Initiative is really working on that. The Governor's Office Human Trafficking Task Force is really trying to help pull this data together, but we're not there yet. So we're working on that. But the what we posed, the problem set that we posed to the individuals on the ARIA, at risk in Appalachia, they chose their own name. What we posed to them was to take the counties in Appalachian, Ohio. So we know what county, there's 32 counties in Appalachian, Ohio. There are certain risk factors that make someone more vulnerable to human trafficking. and generally, substance use, homelessness, runaway, foster care, a number of other factors that are generally known to put someone at a greater risk for being trafficked. And those factors are publicly available information. And so in my mind, and again, this is, you guys, I know it's okay, you can roll your eyes at me all you want to. I'm thinking those old-fashioned transparencies, right? Where since this stuff can all be mapped, if you get a map of one and lay it over a map of the other and lay it over the map of the other, what shows up as darker is where your bigger problems are. Okay, so in my mind, that's what I posed to the students. I said, okay, so I want maps. Somebody give me a visual that shows these factors laid over each other on a map so that I can understand which counties and which areas are at higher risk, because more of these factors lay on top of each other there. And so the students, after just rolling their eyes at me and saying transparencies, really, they said, okay, so we can do a lot better than that. So what they did was they went out and they talked to 40 different people, and I've seen a number of people that are on here that they did talk to already. So they went out and did their own discovery. So they came up with the factors that they saw as the primary risk factors in those areas in Appalachian, Ohio, to make someone more vulnerable to trafficking. And then they went out and they got all the data. They gathered all the data, and again, which is public information, and they put it into maps. So these are the factors that they looked at. They looked at the Gini coefficient, which is the wealth distribution within an area. They looked at poverty rates. They looked at child abuse stats, foreclosure rates, missing children reports, overdose deaths, EMT visits for overdose, domestic violence, and education. And now, granted, the exciting part of this, really, honestly, the takeaway from this, and I'll give it to you now, is what Seth's going to tell you is going to make a huge impact on our understanding of exactly which factors we need to look at. So keep that in mind when you're hearing all this other stuff. But these are the factors that our student team looked at. And what they did, so, help picture these maps. This is what I'm picturing in my mind, right? So we have these maps, we have them available. So Appalachian counties are outlined in a gray outline there. When we look at poverty, and we look within that gray outline, we can see that the Appalachian counties there are much more impoverished, and we can actually see, which ones are more impoverished. If we take the overdose data, and again, this is only one aspect of it, but if we look at the unintentional drug overdose, we can see which counties are more affected by that in the state. And so what they did, and I won't go into, believe me, I won't go into this detail. Remember, I'm qualitative, but what they did was they collected all that data. They pulled down all that data from those public reports that are out there. And remember that we only used Appalachian counties. So we're only comparing within those 32 counties. It's not comparing to the rest of the state. When you see these next maps, they would be different if we were including all counties. So this is just Appalachian counties. But what they did, they got a standard deviation. They got a standard deviation from the mean. They got for each county. And then they assigned a risk score based on the standard deviation for that mean, for whatever it was, that vulnerability that they were looking at. And then the county with the highest risk score was more at risk. And so what this looked like when they were doing it was these counties. So this was the poverty rate. So they brought in the information, they pulled in the information, and you can see, and it's pretty self-explanatory to everybody, that Athens is the top of the list. It has the highest risk for poverty within the state and the highest poverty numbers. And so that's an example of one variable and how they exported that information. They put it all into an Excel spreadsheet. They worked their statistical analysis on it, and then they put it into Tableau, which gave me my visual to see. So here's where I start to get excited when I can see it. And so you can see, I'm just going to go through a couple of variables here. So you can see these are child abuse rates by county. These are EMT visits for suspected overdose. And so you'll see, looking at these counties here, you can see which ones are more at risk. or have higher numbers, but we want to bring in a number of the variables. So we've got the EMT visits, but we've also got the overdose deaths. And there's more we can do with this. There's definitely more we can do with this, but I think the students did a really good job pulling in these variables. These are the domestic violence incidences, domestic violence caseloads. And so, and I won't go through all of them, but basically what they came out with is a risk score for the Appalachian counties. And so if you take a look at that chart on the right, you can see how the counties stack up as far as stacking all those vulnerabilities on top of each other. And so interestingly enough, most of them, because I've been gathering a lot of anecdotal evidence, most of this makes a lot of sense to me. But I was wondering about Mahoning, why that came out on top, because that hadn't necessarily hit my radar yet. And so we did a little more digging and found that the statistic that skewed this for Mahoning was missing children. And so because Mahoning, number one, they have a shelter. Number two, they take juveniles from Cuyahoga and Summit counties into Mahoning County when there's an overflow, and they end up running back. And so just that stat alone kind of skewed this. And so we were able to look into that a little more. It gave us it gave us the ability to ask the questions. And so this is the initial attempt at pulling this data together. This is that overlay of transparencies that the students provided as a point in time snapshot of the counties that were more vulnerable to trafficking, or showed more of the vulnerabilities that put someone more at risk for trafficking. And so therefore, what our hope is that it informs not only the downstream users. So when I would, talking to Scioto County, I would, talk to them about, and go talk to Haley Hatton down there about what's showing up, what these risks are showing, give her this information to see if that could be helpful to her. We've also taken these upstream to the state, to the Governor's Trafficking Task Force, to the Attorney General's Human Trafficking Initiative, to better inform them on what we're seeing in Appalachian, Ohio, and to have a bigger discussion on what we might see throughout the state. And so the hope is to move us from a reactionary approach to more of a proactive approach. So if we can start looking at this information at the state level, we can not only see where the most vulnerabilities are gathering, maybe we can do it at a more granular level than counties, because zip codes are different. I mean, if you think Franklin County, just think Franklin County and the difference in zip codes and how this might portray itself differently. We can go into more detail. One of the things that I'm so excited about, what you're going to hear next from Seth, is that we can assign weights to these variables, and we can assign real variables because of what he's finding. So I'm looking forward to that. And so we are also talking to the Population Health Alliance out of Ohio University, their engineering department, and the Human Trafficking Institute up at Toledo that Celia Williamson runs, to try to work with them to maybe make this not only sustainable, but apply it to the state as well. So we're just in the process of talking to a number of folks to try to get this, give it some life, and make it not only just a snapshot of what the students have done, which was an amazing prototype. And I can't say enough about how excited I am about working with the students, because their ideas are huge. But once we pull in Seth's data and some other information to better inform us, and do some more granular work, I'm just thrilled at the way where this is going, what opportunities we have, and I would welcome any input that you have on ideas, thoughts. It is at the exploratory stages right now, and so I just thank you for letting us talk about it. I will stop sharing my screen, and we will turn it back over to Sarah. So thank you so much.
Thank you, Christy, so much. And now Seth is going to talk more about his data. Go ahead and share your screen.
There we go. Can everyone see and hear? All right, perfect, outstanding. Yeah, so kind of building on what Christy's been sharing here, it's a very exciting time. For the prior 21 or so years, since human trafficking has really grown as a body of research, an area of study, and also as an area of practical response in the field. One of the biggest things that has been a fundamental barrier to our response statewide, nationally, at every level, is our ability to accurately capture what the nature of the cases are, what the populations are, for all of the reasons that Christy said. Data is very often non-uniform. It very frequently does not have shared definitions, so it's very hard to meld that data. Even if that data can be translated from one system of collection to another, very frequently it's very heavily siloed within our systems. And this profoundly undercuts the statistical power we have. And in turn, what that leads to is that we aren't gaining the insights we need to turn the data collection process from not strictly an academic exercise, but turning it into something that can actually inform our practical operations, our response to populations that are being trafficked within Ohio and beyond. So with the kind of foundational work, and I'll kind of work my way back there, there is now an opportunity for us to start by sharing information between our agencies and arriving at these unified definitions to really start answering some practical questions that have gone unanswered for the last 2 decades. So with that intro, I'll jump in here. So, all right. So we had a grant that came through back in November 21st of 2017 through ODJFS. And we were looking at what are some of the fundamental things that we do not capture currently with cases that are being referred into CACs. CACs are a really great place to kind of de-silo this data. And so there was a real opportunity back in 2017 to start pooling information across all of our various multidisciplinary team partners. So that included medical professionals, forensic interviewers, mental health professionals, law enforcement, on and on. We finally would have a way that by presenting a standardized survey, we could collect the same data across all of them, each and every one of these disciplines. So things that we were really interested in, we really wanted to get case profiles, offender profiles. We needed to know what types of services were being provided. What were the risk factors that were present across different types of trafficking? So we didn't want to just focus in on the bias towards sex trafficking. We also wanted to know, how frequently were we receiving referrals on labor trafficking? How did those risk factors differ from those that we would see among the confirmed sex trafficking cases? We also wanted to be tracking what role internet was playing in technology in the grooming and exploitation and production of child sexual abuse materials across the cases being referred. And then we really, knowing that these cases are profoundly under-identified still, we really wanted to create a way to at least approach capturing what populations are going through our CACs that very often would not be identified as a trafficking case due to a lack of disclosure. As we all know, disclosure comes as a result after years of treatment. Very often there's this paradigm that we expect disclosure to precede services. So kind of reversing that process. So we, using the best research we had back in 2017, constructed about 19 different risk factors that we could evaluate across, and then just set a metric standard across all participating CACs in the study to figure out which populations, based off of clinical expertise and kind of wisdom from the field, what would hit a threshold for them to then initiate an investigation with their law enforcement partners and clinical services within that domain, even in the absence of that disclosure. Then we wanted to know what the case outcomes were, whether human trafficking coalitions in our state were involved in these cases and provided resources. We were interested in what our child welfare dispositions were around these cases, what role drug use played, both in as a means of control for the children who were being potentially exploited, as well as motivations for, say, things like familial trafficking. I'm foreshadowing here, we're going to get into that in a little bit. Then we wanted to know, things about, our case numbers, whether there was limited interactions, I'm way off here. So we wanted to address the issue of small case numbers across various disciplines. Sorry, getting way ahead of myself. Then the data was compartmentalized and often incompatible with other databases, as Christy had said, and isn't capturing the unserved population. So we were lacking the level of case data to help us start estimating what populations should we be seeing? What sort of gaps are there? If we're serving a population that has profile X, we would expect a standard sampling of cases to be somewhat representative within that general population. But since it isn't, then we know that we aren't identifying them. A good example of this is our labor trafficking cases. While we might have found 205 cases of child sex trafficking, we only identified 4. That disparity can't be compensated for by saying, oh, well, labor trafficking isn't occurring at that kind of rate. We know that with the Trillium case alone, that we were seeing numbers that were extremely significant compared to that, yet almost none of these cases come through our service system. All right. So I want to give us enough time to go through the data, so I'm going to kind of breeze through the mechanics here. But we did receive this grant through ODJFS. We were able to provide financial assistance, which helped increase our service capacity to the children being served whose cases are involved in this database. So we wanted to make sure that there was good reciprocity in compensation and direct benefit to the cases from which we collected this data. It also allowed us to develop an on-target webinar series, which allowed us to provide direct innovative service practice concepts to providers, and that was open to anyone who could attend at that time. So what we needed to know, what life factors are commonly targeted by traffickers or place children at an elevated risk? What are the demographic profiles of both child victims and the traffickers who exploit them? What are the prominent referral sources for these cases? And looking for areas where we can increase that partnership. And how do members of the multidisciplinary team, including law enforcement, prosecutors, mental and medical health professionals, forensic interviewers, and family advocates respond to these cases? Because it's great to want to identify these cases, but it's absolutely critical that when we do identify them, that we are actually meeting their needs. We also needed to know how frequently is safe harbor implemented in eligible cases. Studies still to date are showing that most states where safe harbor law is being implemented, it is not being practiced or implemented in most eligible cases. Cases are ruled out either because there is a misconception that, say, capital offenses can't be included under that, or that you need to have considerable evidence that trafficking has occurred, when really in most states, including Ohio, the threshold is simply reason to believe, which is the lowest threshold possible. So there's a lot more children who could be receiving that service, and that is reflected in our data. And then we wanted to know what role drug use and dependency plays both in the coercion of victims and the underlying drives of traffickers. And we did record also what types of drugs were specifically involved in these cases. Among cases referred to the Ohio Children Advocacy Centers, what is the apparent prevalence of different types of trafficking, as I went over previously? And what are the CPS determinations in these cases? And how are these cases charged and prosecuted? So we wanted to know what types of law enforcement were involved, what the arrest types were, arraignment decisions, court types, and what those trial outcomes were. A caveat I'll put on that is under the structure of the grant, data was collected based off of intake quarterly. So we did not actually attain a statistically significant measure across those factors, but I will get into plans in the future that we have to more accurately track what these long-term outcomes are in terms of prosecution. And then what was the residence or placement at the time of intake versus currently at the time of reporting? This played a significant role in tracking accurate implementation of safe harbor laws. If we saw that a child had been transferred to a juvenile detention center, but was considered ineligible for safe harbor diversion, then we really wanted to look in qualitatively as we were providing technical assistance along with the study to see what the preconceptions were that were leading to that determination by the MDT. And then information at the county level is available regarding the location of the CAC and the sheriff office as involved. That is, of course, privileged information because it's very identifiable, but that is information that we gathered as well. And data was collected for a period from November 21st, 2017, all the way through June 30th of 2019. So now we'll jump into the data and what we found here. And I encourage people, if they have questions while I'm presenting, absolutely enter them into the Q&A box there. And I'd be happy to pause and field questions or any types of insights or ideas any of you might have, because the whole purpose of sharing this data is that we can all kind of benefit from our collective perspectives on this. So not surprisingly, a large amount of the cases that we saw, 90% were female, about 8.6% were male, and 1% were identified as transgender. So once again, we know that there's a larger transgender population in Ohio among youth, and this is a deeply underrepresented population within the cases that were being identified. And current studies are really starting to indicate that these LGBTQI populations are at an elevated risk. There's often an increased vulnerability to housing instability, runaway status, and so there's a lot of intersectional factors that can place them at an elevated risk. So we would expect this number to be higher if we were actually being referred the number of cases that we would actually expect based off of the population. Then in terms of child race ethnicity, we always track this information. This becomes more critical when we start looking at specifically the communities we're serving, because we know that there can be an intrinsic bias or skewing of data towards certain racial populations and ethnic populations within communities served. So we want to make sure that that is aligning closely with what we see in other cases. So when we're looking at across the broad spectrum of cases that CAC see, we can compare our human trafficking case referrals along these metrics as they compare to, say, child abuse, child sexual abuse, neglect, all of the other things that we do respond to as the CAC. And when those things aren't proportionate to each other, then we really need to start asking ourselves why that might be the case. Then we tracked Hispanic and Latinx populations identified within this group. Something I would do in the future is this was a way to get at linguistic isolation and language barriers potentially within populations. Due to the nature of the study and the research available at the time, we were focusing on Spanish, especially Spanish as it relates to labor trafficking. However, each community that a CAC serves has linguistically isolated populations within it. So building this out to actually capture what languages are being spoken by individuals referred relative to the number of languages being spoken in the community is a really good way to get at if people are being under-referred strictly due to linguistic household barriers. Age, we collected age data It, of course, ran a significant range. Our youngest case was 2 years old. Our oldest case was over the age of 19. We only tracked up to age 19, but CACs will serve adults with developmental or cognitive disabilities. So we really wanted to make sure that that in the future we expand this so that we are capturing those individuals, because they will be underrepresented in the data. And our mean age was age 14, which is consistent with a lot of the current studies that we find. Then in terms of our referral sources, this does closely bias towards what the CAC model is. A lot of our intake processes are dependent on our MDT partners. So the vast majority of cases will be referred to us by Child Protective Services or law enforcement. But we do receive referrals from medical providers, especially as medical providers in Ohio are increasingly trained on how to identify cases of trafficking and medical identifiers related to trafficking. Then JDC, we did see an uptick in the later years of this study as DYS developed a screening instrument to assist in identification of these cases. So this number is a little bit lower than our current annual rate, but it did uptick once they were provided an instrument to do a brief assessment for trafficking for youth coming in through the DYS into JDCs, things of that nature. Juvenile courts, our highest rates of referral were in counties that had developed some sort of a diversion or safe harbor court system within their counties. In counties that did not implement safe harbor or have a diversion court, we saw almost no referrals from juvenile courts. And then other and unknown, of course, always included in those. For our alleged perpetrator profiles, we found that 52% were white, 36% were Black, 11% multiracial. Suspect age, average age was about 29 years old. Minimum age for a trafficker was 15 years old. Maximum age was 76 with a mean age of 32 there. Yeah, actually the 29.5 is a typo there, 32, sorry. And then relation of suspect to the child. This also is going to bias towards the CAC model since most of our referrals come from child welfare providers, child welfare agencies. So a lot of these are going to be family involved cases. However, it's interesting because a lot of the current studies out there that have used law enforcement data deeply underrepresents the rate of familial trafficking. So this can serve as a counterpopulation when we start de-siloing this data to really get at a much closer representation of law enforcement tends to see a lot of trafficking by paramours, peers, things of that nature, paramours of family members potentially sometimes, but it really tends to be more of outside of familial trafficking, whereas the CAC see almost predominantly exclusively familial exploitation of the child. So mothers coming in at 17.9%, fathers 13.2%, and on down the line for friends, brothers, cousins, boyfriends, etc. Then for our life vectors that can be potentially targeted by traffickers, we were largely rooted in the data available and the research available at the time. So a lot of these are going to be focusing on historical risk factors. However, there are a number of studies coming out just within the past year or so that specifically are indicating that while these historical risk factors are important to look at, the current and proximal risk factors are actually going to play a much deeper role in the predictability for high risk. So those are going to be things like deteriorating relationships with the caregiver, low self-worth, mental health vulnerabilities, frequent runaway status, signs of peer recruitment, declining academic performance, ongoing substance use, caregiver strain, which is different than a deteriorating relationship. Caregiver strain might be something like an under-resourced caregiver who is unable to provide certain insulating factors. Then resource gaps, getting back to a lot of what Christy was finding, things like that Gini index, housing instability, all of those factors. So those are things that we really want to be starting to look at. And in future data collection, I would absolutely want to be integrating those into the data collection process. For the historical data that we did collect, we found that history of sexual abuse as a child was present in 56% of the cases. History of runaway, which we counted as 4 or more times within the past year, was present in 55% of cases. Then we found homelessness in 15% of cases. Once again, a little bit skewed because we're once again receiving a vast majority of our referrals from child welfare agencies that may not necessarily be involved in those cases where the family is not present or identifiable. However, law enforcement became a very strong referral source for the homeless youth. Truancy, we found that to be in about 38% of cases. Juvenile court involvement, around 45% of our cases, we see that. And both juvenile court involvement and the Child Protective Services involvement, it's always just important to note that that involvement itself is not a risk factor. What it is indicative of is an intersectionality of a number of risk factors. So it's an easy way to capture very quickly whether there is a long series or history of life factors that might be elevating risk. Drug use, we found, was present in 40% of cases. Psychiatric admissions, 22% or 23%. Multiple sexual partners, so this would be concurrent sexual partners, was 53.3% of cases. Sexually transmitted infections or unplanned pregnancy was present in 27% of cases. Then for the internet piece, we were tracking history of meeting others online or posting pictures online, and within the forensic interviewing, determining whether those would be child sexual abuse images. So we found that present in 37% of cases. The second tier of factors that we were tracking could apply to the labor aspects of sex trafficking, but we were really trying to focus in on things that would be potential elements within the forensic interviewing process that would capture labor trafficking. As I've said, the labor trafficking population was deeply underrepresented, so these numbers are low, but it definitely is showing an area that we need to really think about developing a more robust referral response and identification system. So individuals transported in large groups to and from workplaces, around 2%. Individual sleeps or resides where they work, we found that in 6% of cases. Individual works in a place that makes them feel scared or unsafe, 3% of cases. Individual has undocumented immigration or refugee status, 1% of cases. Individual travel for work or education, only to find they weren't doing what they expected, came in around 9%. Individual owing money, something of value, came in around 4%. Individual has been tricked or coerced into completing work they did not want to do, came in at 43%. Predictive of labor trafficking, yes, but also a considerable overlap with sex trafficking as well. Individual is scared to leave or quit their work situation due to fears of violence or threats of harm, found in about 4% of cases. All right, in terms of services provided through the CAC, we wanted to make sure that we were providing a full range of applicable services in each of these cases. 87 were provided a forensic interview, 70% of cases received medical services, 72% received mental health services. An abuse assessment was applicable in about 11.4% of cases. Substance abuse services, 2.9. housing referral placement 3.8, faith-based services around 1%, case management 38%, victim advocacy 60%, case tracking 74%, and trauma screenings in about 10% of cases. Things that are of interest to me within this is that we know that housing instability is a considerable factor. And we know that in almost half of the cases, we saw that substance abuse use was involved in these cases. So digging in deep to think about what types of networks we can connect through, say, something like relink.org, where we can actually tie together and connect with service providers that could meet some of these needs that are usually kind of a little bit more outside the purview of our core MDT, and usually is really dependent on how well connected they are within resources within the community. This becomes a really huge piece about creating a more holistic response to these cases. So there's a huge opportunity here to really build that out. Now, some of these numbers skew once again a little bit lower because it can take a little bit of time outside that quarter unit within which we were collecting data. So if they were set up with services, let's say a case came in the final week of a quarter, we were collecting data and they were linked with services in the following quarter, that was not recorded. Additionally, approaching this from a trauma bonding perspective and understanding that this follows a model very similar to domestic violence work, where these individuals are likely, due to the endogenous opioids in the brain that are released in a trauma bonding situation, it is very likely that it will be a cycle of return to services and then returning into the trafficking situation. And so training up our staff so that they are an open door and always there to receive and provide these services when the trafficked individual is ready to receive that type of help, that becomes a really huge part about the success of any type of intervention model. And that is reflected in these numbers. Gonna take a little tea. All right. So in terms of CAC partner involvement, the caveat on all of this is that this is based off of partnerships that were established prior to the reporting of the cases. So all of these numbers are a little lower than we would expect, but they still can provide us some insights. So human trafficking coalitions were involved in about 28% of our cases. This was specifically true in cases where the coalitions have moved beyond simply educational work, which certainly has its value, but also have moved into a place of like connecting resources. Things like the Cleveland Coalition really focuses on making sure people are aware of the services that are available and making sure people are trading emails, trading contact information so that these things can be accessed. So that's really critical. Child Protective Services were involved in about 82% of cases. They are on our MDTs, so that's not surprising. Child Protective Service determinations, unable to determine, made up the majority at about 44%. Pending 10%, substantiated about 10%, unsubstantiated about 10%, other and unknown, largely due to that quarterly cutoff we had on our data collection process. It does speak to the need, we run on a home rule system. Some child welfare agencies are absolutely phenomenal at identifying these cases. Other ones could really use funding and better resources so that they have what they need so that they can really start identifying these cases and having the bandwidth to really do the training necessary so that potential red flags don't go under the radar or get screened out. Or certainly if they don't fall under the purview and it isn't a familial trafficking situation, that they still get referred to CACs who can still provide services, even if it's outside the purview of the mandates of a child welfare agency. Then for safe harbor implementation, this is the big one. So only about 6% of cases that were eligible saw safe harbor implemented. Remaining 65% of cases where safe harbor seems like it could have been implemented, it was not. And then in an additional 30% of cases, it wasn't tracked at all. There was no reporting around whether it was or was not applied, or the person filling this out was unaware of safe harbor law completely. For arrest types, this data is incredibly skewed based off of the fact that cases and trials take a long time. These processes are very long duration. So you'll see I could go through all of these, but for the sake of having time for questions, and also the fact that this data is skewed considerably down, this is just a recommendation for the types of things we want to start evaluating, but we need to start collecting data that's more longitudinal over time. So where do we go from here? And Christy laid some phenomenal foundational work, some really revolutionary work that really can guide how we can apply currently available data to this type of case data collection, so that we can marry both the phenomenal surveys that already exist, things like the American Community Survey, things like that, with the actual what we're seeing on the ground. This is where we can actually turn this into practical insights. So lessons learned from emerging research is that prevalence of unserved and underidentified youth remains a significant challenge. However, recently there was a study by Anderson, Kulik, and Sullivan, 2019, where they used Stata's data link tool, which allows you to flag and identify potential duplicate cases across data collection systems from different agencies. And you can actually then flag those, manually go in and actually see if they are the same case being reported by two agencies. So this helps address some of that siloing issue and some of that incompatibility. By arriving at standardized definitions and working within organizations that already bring together multidisciplinary teams, these two things together can really help us create a unified database that will help us start seeing what our full complete response is across all points of contact. The next one, as I've harped on a little bit, is the proximal risk factors indicated as potentially more predictive of exploitation. And we really want to be able to remove selection bias in these studies. So there's the potential for predictive regularization and monitored machine learning. So one of the big issues we have currently with all of the validated screening tools that we are currently using to date is that they were developed by people, and people will have a pre-made list of risk factors that they think are going to be predictive of trafficking. And that leads to a spotlight effect where we are only always looking for the same types of risk factors that have been seen in previous studies, that have been seen in previous studies, that have been seen in previous studies. And so what you would do is you would actually collect raw data across cases, see all the risk factors that are present within those cases, and then the machine will run a statistical algorithm across those and figure out, okay, we have the 80 different factors. These 16 are the ones you really want to be looking for that are indicative of an extreme risk of grooming, ongoing grooming, or current exploitation. And so we are starting to get to a place where we can start having the sufficient statistical power to teach the machine under a monitored status to figure out what these risk factors are. And then we can build studies that build towards that validated instrument that we've been waiting for 20 years. So how do we reliably identify cases of grooming and child trafficking, build a robust profile and screening instrument from a national sample of data, pulling from a vast multidisciplinary response network, and tailor models to account for elevated risk, grooming, and trafficking. These are kind of summary slides, big takeaways. And once we do know how should our MDTs respond, once we can identify them to ensure favorable outcomes for both victim recovery and the effective prosecution of traffickers. So we can use big data systems from forensic interviewing software partners in combination with qualitative direct feedback from MDTs and partner agencies to identify and code for distinct approaches, then correlate the case team outcomes to identify effective strategies for case profiles, similar to evidence practices that we already use in mental health. So we would develop basically an evidence practice that works across our various agencies and the various modalities and needs that we need to address within the trafficked population. And then where we're going to go next. So we have been, for the last several years, been putting together these community assessment reports, building on these very large surveys. And they work across a number of factors. And we will probably be doing, I believe, a part 2, where we will actually be diving deep into this, because it can be its own presentation by itself. So stay tuned for that. But using what Christy has built, we will now be able to take the case data we're collecting, use all of these various measures. There's about 35 of them that we've identified within the report. These are just 4 of them. And then apply that same rating of risk algorithm, and we can dial that in. Some of these factors are tracked at the county level. Some of them are tracked all the way down to the zip code level. And we will be able to weight risk factors both within these larger systems and the data we collect around risk factors present within cases across different types of trafficking. And then we can start actually melding these large database systems with what we are practically receiving as information from the field to develop the type of response that we should have for trafficking. And that pretty much wraps it up. Thank you.
Thank you so much, Seth and Christy. You guys did a wonderful job and shared such wonderful information. I'm so excited to have had the 2 of you together to present to us today. And I'm even more excited that we are going to do a part 2 and make sure that we can get even more information out there. The link to register for part 2 is actually in the chat at the very beginning. I put it right at the top. So if anyone is interested in joining this conversation again and seeing how now we can take this data and what all can be done with it, I'm so excited to continue it. And so the link to register for part 2 is in the chat. And then now I am going to hand it over to Bill and see if there are any questions that we need answered live here.
Thanks, Sarah. So the first question that was asked earlier, this is for both Christy and Seth. What is the definition of human trafficking that you use for your data?
You bet. Do you want to go first, Christy, or should I?
You can go ahead and go first, because basically what we used when we were looking at that was the federal definition.
Yeah, and we use the federal definition as well for our base definition for sex trafficking and labor trafficking, emphasizing the lack of need for evidence of force, fraud, or coercion in these cases. But then we also wanted to account for the fact that the context also extends beyond what can we prosecute, because we also are interested in the treatment of the children that come in through the CAC, whether there is a case built around the circumstances of their exploitation. So we built an in-house definition and criteria for them to use it all, which was based upon clinical significance. And so that gets back into those risk factors. And I'd be happy to share that whole outline, because it's a whole essay basically. But it's basically saying that if they had any 4 of the, here, I can go back actually. Let me screen share again here. All right, so if they had, if it'll let me scroll back, there we go. All right. All right, here we go. Oh, no, there we go. Went too far, sorry. There we go. So if they had any of the 4 of the risk factors that were above individual transported for large groups, so basically above our labor trafficking points. If they had any combination of those 4, so history of sexual abuse, history of runaway, homelessness, truancy, juvenile court, child, so on. If they had any 4 of those indicators, plus 2 of the ones below, then we were counting that as a clinically significant case. So that might not necessarily mean that it was a case of trafficking, but certainly a relatively elevated risk of exploitation or ongoing grooming without disclosure. So we wanted to capture that as well. Labor trafficking definition was also based off of the federal definition. And then for the internet exploitation piece, we also included our own definition, which was basically any evidence of ongoing online grooming or production of solicited materials from a minor of a sexual nature. So, yep, there we go. Good question.
The next few questions were asked during this slide, actually, the one you just had up. So, yeah, why do you see it a fact that CPS contact isn't a risk factor? Did you prove that there was no causal correlation?
Could you run that question by me one more time? I was forgetting.
Yeah, sure. Why do you see it a fact that CPS contact isn't a risk factor? Did you prove that there was no causal correlation?
So I think I understand what he's asking. So we included CPS, and ask me again if I missed the answer on this. We included Child Protective Services involvement as a risk factor because it is once again very indicative of a number of intersectional factors. So while we didn't directly measure a lot of those current and proximal risk factors that we would want to really tease apart, things like caregiver strain, things like housing instability, things of that nature. These are things that CPS often sees in their cases. So it is a catch-all of a number of intersectional risk factors that lead to CPS involvement. So instead of capturing all the things that our CPS partners see that are potential risk factors, we just see if CPS was involved in the first place. Now, the fact that it is clustering together a number of risk factors under one single event or pool causes two issues. The first one is we know that not all cases that need CPS involvement get contact with CPS, that those referrals happen from mandated reporters. And the other thing is that this is probably scaled up a little bit. I would imagine if we broke this down into all of the proximal risk factors that lead to CPS involvement, I imagine the 60% number is going to subcompartmentalize into different components around things like the relationship with the caregiver, housing instabilities, histories of abuse, things like that. So we really want to unpack this in the future. I hope that answered the question.
And our last question is also for Seth regarding the slide. Did you look at ACE score for each child?
So we didn't actually collect ACEs data for each child, and that would also be something I'd be interested in. There's a certain amount of vetting, I think, that needs to occur around how ACE scores account within this population and whether ACE scores are have a predictive value within the population. We certainly know that they are predictive of long-term outcomes, and there's some very good studies out there around child trafficking populations that are looking at kind of the long-term impacts. So I actually, as I'm brainstorming, just because, once again, good question, I could see a really tremendous value in monitoring those ACE scores. And as that works longitudinally, as we do work with these populations and enhance our response, because we know that kids who are trafficked miss a number of core milestones, both educationally and developmentally while they're being exploited. And that's a lot of the factors that are wrapped up in ACEs, is that trauma intrinsically inhibits development. And so if we could start tracking those ACE scores, that actually could become something more than just an outcomes measure, but an impact measure for whether we are successfully responding to the needs of these kids. And there's a program, Elevate Academy, through the Rebecca Bender initiative that's entirely built around helping survivors of trafficking rebuild, and attain those various benchmarks educationally and professionally, and things like housing stability, things like that. So I think there's tremendous value in absolutely tracking some of that ACE data. Absolutely, great question.
Another question that just came in was, do you track whether or not one of the child's parents were incarcerated?
So we did not track that in this. So we tracked the nature of the relationship to the child and whether they had any drug use history, but we didn't actually track that. So that would also be, I think, tremendously valuable to track, what their previous history is with charges, incarceration, what that arrest history is. Yeah, great. Thank you. Going to make a note.
So that is the last question that I see in the Q&A and the chat. I'll throw it over to Sarah right now.
Well, thank you everyone for joining us. This is a wonderful discussion. I'm very excited to continue it. We do already have 40 people signed up for part 2, so it's looking really good. I'm really excited about this discussion, and I appreciate you, Seth and Christy, so much. And everyone have a great rest of your Thursday and enjoy the weekend. Thank you, everyone.
Well, thank you so much.